Okay, so I'm going to do a few little Instagram bursts about GLP-1s, which seem to be the order of the day. So let's try to do those. And then what I'm going to do also is just let you know what's happening in the growths. So I want to talk about ultrasound and echocardiography. I want to talk about a new ADHD clinic. And then I want to talk about keeping well hydrated through the summer. So we're going to do little bursts, and there'll be 4 or 5, and we're going to try to do things regularly. You'll notice I've got this new little microphone, which is meant to help. Who knows? We'll see. Okay, so the first thing is, what is a GLP-1? There are currently, and it is confusing, two main drugs on the market. One is called semaglutide, and that is sold as Ozempic and Wegovy. And as of this week, both Ozempic and Wegovy are available both as tablets and as injections. The tablets are called Wegovy or Rybelsus. The injections are called Ozempic or Wegovy. The other drug is called Mounjaro, which is a totally different drug, and the trade name is Mounjaro, and is more expensive, made in America. All the injections are once a week, and they have a variety of doses. Ozempic, Wegovy are priced per dose and go up in price. The patient this morning on the maximum price, the maximum dose of Wegovy. So the maximum dose of Wegovy is costing about £180 a month. The Mounjaro comes through the States and therefore has a tariff on it, which I think means that Mr. Trump wants it to cost the same in Europe as it does in America. And therefore it's flat priced. The 2.5 and 5 is one price, the 7.5 and 10 is another price, the 12.5 and 15 can cost up to £380 a month. So they're roughly 180, 240, 380. If you shop around, you'll find different prices. What's the difference between the two drugs? Semaglutide was the first drug on the market. Both these drugs are designed for diabetes. They lower your blood sugar. They also found that diabetics taking these drugs lost weight, and therefore they're used for weight loss. And that's what's been going across America and the whole of Europe. And actually, the two weight loss drugs are the largest prescriptions we write each month at the moment. So that tells you how many patients in quite a large private practice we're actually seeing. We prefer, but not always, to only start if your BMI is greater than 30. But under circumstances where there are medical issues which would help with weight loss, we may consider starting a little bit lower. What seems to be apparent and what is very important is, without doing something else, when you stop these drugs, you will gain the weight back. Maybe not all of it, and maybe not initially, but the bottom line is, if you stop these drugs, you will gain the weight back. The other thing is that the weight loss is indiscriminate. The drug does not know what is a muscle or what is a fat cell. So unless you do some exercise, which doesn't mean a lot, it could just mean walking or a can of baked beans in each arm, doing some exercises to keep the muscles in your upper arm. Unless you do that, you will notice that you lose muscle bulk as well. And for many where this is around shape, that is very important.